Researchers at Washington State University are working with specially trained dogs to sniff out little cherry disease, a disease that causes trees to produce small, unmarketable fruit. The dogs in the study, Huma and Ikea, have shown incredible accuracy, even beating lab tests in early trials. Experts hope this canine detection method could help growers catch infections faster and save entire orchards from costly losses.
And speaking of dogs at WSU, the Veterinary Teaching Hospital has been working on a study involving local dogs for more than 5 years now. Our reporter Josiah Pike has more on what they're hoping to accomplish.
Calling all canines, the WSU Veterinary Teaching Hospital needs help from your dogs.
But it's not because they're sick. If anything, it's actually quite the opposite. As you see, the help that these dogs provide to the Veterinary Teaching Hospital over here may actually be able to help other dogs in the future.
WSU veterinarian Dr. Tanya Perez says the study involves seeing how different dogs will react to types of medicine. The study has been going on since 2019.
And basically what we're trying to do here is make it safer when your pet goes to the clinic. And then if your pet has history of having an adverse reaction to a medication, then with this test that we're trying to develop, you will be able to do that.
Perez says this research will involve giving the dogs 3 medications that are used clinically, including Robitussin and omeprazole. After that, they will take blood and urine samples from the dog and look for results in the blood. The more dogs used, the more accurate the study will be. The dogs are able to go home the day of the study.
We're basically recruiting dogs between ages of 1 to 12. Another thing is that according to history in a medical evaluation, they should be considered healthy. And that also includes, obviously, that the patient is not taking any medication for any kind of disease.
Perez says the goal is to have about 200 dogs for this study. So far, they are about 20 short of that goal. Rachel Hall and Emma Drivdale both contributed 3 dogs for the study. McCall, Drivdale's nephew dog, is the one you can see here. Both of them are involved in the veterinary college at some capacity and were told by people they know about the study.
In the beginning, when the first round of dogs were happening, both my bigger dogs, Isabel and Smushy, were in it. And then just recently, I guess the end of last year was when Mavi was in it.
I do think it's important just because we need to know how dogs are going to react to different medications to be able to take care of them to the best of our ability.
Once they reach it, the researchers plan to study the results from the dogs and see what the general findings are. People interested in possibly letting their dog be used for this study can contact the Clinical Studies Coordinator at the Veterinary College. Josiah Pike, Murrow News 8.